Up next is Dr. Robert Bard, cancer imaging expert from the United States, presenting his views on non-invasive diagnostic technologies.
All the therapies can cause neuritis, inflammation of the tendons, inflammation of the soft tissues. Everything goes wrong and everything's positive on a PET scan. This is a big deal because if you're a cancer survivor and you either have a lump or you get a PET scan and something lights up, what is it? Well, the doctors don't know and the patients don't know enough to ask. We measure and document how aggressive a tumor is using blood flow. This technology is so good, it's been refined by adding newer technologies, which of course are not yet widely used in this country, such as contrast ultrasound, and we're using now elastography. Here's a common presentation. There's a lump under the arm after somebody's had cancer, in this case, a breast cancer. So where do you stick the needle? Notice in the top left, it says 27%. This is quantitative imaging. It shows you where the cancer is and how aggressive it is. Now, on the other side, where you see the black area, vessel density 1%, you put a needle in there, you get dead cells, and the pathologist calls you back and said, I can't read this. We're using the same technology on breast density. The same thing with the axillary lymph node, by the sentinel lymph nodes. In Europe, they don't do it anymore. They image with ultrasound. If it looks nasty, you put a needle in, get some cells out, and axillary and lymph node dissections are messy. Yeah, this is a PET scan. You can see the arrows. This is one of the new PET scanners, not the old one. This is digital PET, fewer false positive. This is a metastatic focus. See the blood vessels on the left, the fluid in the middle with the regular sonogram, but on the right is something new. This is the elastogram, which shows cancers are hard. When you treat a cancer, it gets soft. The red is soft, so this cancer is dying. What people do not understand, even many doctors don't understand, when tumors die, they get bigger because they swell with dead cells and fluid.
While elastography is relatively new in the United States, its contribution to tumor validation is recognized worldwide. The latest digital PET/CT scans are also bringing a new level of quantifiable readings that successfully prevent unnecessary biopsies and false positives. Dr. Bard's concept of integrative cancer scanning with complementary, non-invasive imaging technologies paves the way for a faster and more accurate way of tracking cancer aggression. This allows for the adjustment of therapies as needed in a timely manner.